The mouth is one of the most important parts of our body. With it, we eat, drink, communicate with others, smile, laugh, and explore our world. Without a clean and healthy mouth, we don't look or feel our best. Daily mouth care prevents painful toothaches and infections that can spread and harm other parts of the body. This is true for all people, including people with disabilities and frail elders. This program will help you overcome obstacles to oral health for yourself and people you care for. After watching this video, please use the companion workbook to continue learning. The ideas you will see in this video can be used with a variety of people and settings. Decide what you will do based on the individual you are working with, their individual care plan, and the policies in place in the facility where you work.
I'm finally starting to get the hang of things here.
Good.
The only thing I'm still having some trouble with is dental care.
Well, I've got some tips that'll be very helpful to you, okay?
Great.
Did you know that infections in the mouth can spread to other parts of our bodies? It may sound surprising, but dental infections can affect heart problems, diabetes, stroke, aspiration pneumonia, and other serious health problems. The people that you are taking care of have a variety of medical, physical, and other kinds of disabilities. However, there are things we can do daily that can help everyone have good oral health. That includes frail elders and younger people with disabilities in nursing homes, group homes, or private residences. When you are helping someone clean their mouth, there are several things to keep in mind. Some people don't have any of their own teeth. Their gums should look pink and firm. Redness or sores are not healthy and could be caused by poor-fitting dentures, infections in the mouth, or first sign of cancer. It's really important to look at the gums under dentures. Ask the person to remove the dentures. Here's what to do if they cannot do it themselves. Remove the upper denture by sliding your finger in and pulling down on the back edge to break the seal. To remove partial dentures, carefully lift up on the metal or wire clasps that go around the teeth and gently lift it loose. Make sure that the denture has the person's name on it so it will not be misplaced. In some states, it is a legal requirement in long-term care facilities that dentures be labeled. For people who have teeth, the differences between a healthy mouth and an unhealthy mouth are easy to see with good light and a little practice. A healthy mouth has pink gums that fit tightly around the teeth, and the gums don't bleed while toothbrushing. An unhealthy mouth is indicated by red, swollen, or tender gums, gums that bleed easily when brushed, or teeth with dark stains or cavities. Be sure to look at the corners of the mouth. Look for cracks or redness. This could be a sign of an infection that can be treated with medication. In addition, bad breath and difficulty chewing can be signs of pain and infection. Finally, look for signs of a dry mouth. Dryness in the mouth can be caused by dehydration or medications or disease. A dry mouth can be painful, make it difficult to swallow foods, and increase cavities, especially around the roots of the teeth. Do you know what causes cavities, bleeding gums, and bad breath? All of these problems are caused by plaque. Plaque is white or invisible and is loaded with bacteria. If we look at the plaque under a microscope, we'll see that it is made out of many kinds of bacteria. When we drink or eat foods containing sugar, the sugar feeds the bacteria in the plaque, which turns into harmful acid. This acid eats away at teeth and roots and causes tooth decay and gum disease. Remember, bacteria eat the sugar we eat and produces acid. Bacteria plus gums equals bleeding gums and gum disease. Acid plus teeth equals tooth decay. So, it's very important to reduce the frequency of sugar we eat and remove plaque daily so mouth bacteria can't grow and cause all these problems. Did you know there's sugar in many common foods? Some are obvious like cookies and soda, but there's also sugar in foods like breath mints and raisins. Also, remember that soda contains acid and can dissolve the teeth. There's also sugar in liquid medications and antacids. So it is best to limit foods with sugar and acid to meal times so the bacteria will be fed as little as possible during the day. Avoid sipping soda or coffee with sugar all day. After eating sugary foods, we should rinse our mouths with water or a mouth rinse, or brush our teeth to keep the harmful bacteria from having a feast of their own.
So now we're gonna go visit Mabel, and some of the techniques I've been showing you today, we're gonna try with her, okay? You ready to go?
Yeah.
The key to removing plaque is good toothbrushing. Only use toothbrushes with soft and flexible bristles. Avoid hard bristles that can damage teeth and gums. And be sure to replace your toothbrush when the bristles become spread out, about every 3 to 4 months. Every person should have his own toothbrush that is clearly marked and stored separately. If you are using an electric toothbrush, every person should have their own brush and base, again stored separately. Rinse off any toothpaste from the brush and store it so it can dry out every day. Be sure to follow the regulation about how mouth care products are to be stored in the facility where you work. Electric toothbrushes can be helpful. For example, they can help people with arthritis or other problems hold the brush handle. Also, if you are helping someone brush, they are easy to use. Use light pressure and let the brush do the work. Notice that both toothbrushes and floss holders can be adapted in different ways to make them easier to hold. Focus on brushing at the gum line and establish a standard pattern when brushing teeth, making sure to brush the outside and inside of all teeth. Follow the same pattern every day. To brush the gum line, place the toothbrush half on the gum and half on the teeth while brushing. Tip the toothbrush at an angle and use a circular motion to remove bacteria and massage the gums. Be sure to work the bristles of the toothbrush under the edge of the gums when you brush. Don't try to clean teeth with a tooth sponge. They do not remove plaque and bacteria. Did you know that there are now several medications that can be used in addition to toothbrushing and flossing and can help prevent dental disease? Some medications kill germs, and others make the teeth stronger. The workbook provides more information about the use of products like chlorhexidine, xylitol, and fluoride varnish. Fluoride varnish is easy to paint on with a little brush and strengthens teeth and prevents cavities. While most of us can clean our own teeth, many frail elders and people with disabilities need our help. Each day, use these 7 steps to clean or help clean someone's mouth. The first step is getting ready. Get all the supplies that you'll need and explain what you're about to do. If you're not sure about the person's abilities, ask them or watch to see what they can do for themselves. Only assist when needed. Step 2 is protection via putting on gloves. If you are brushing or flossing someone's teeth, there could be little droplets of saliva released into the air. If you anticipate any splatter, you should also use protective eyewear and a mask. If you are sure there will be no splatter, for example, if you are only giving verbal prompts at a distance, then a mask and protective eyewear may not be necessary. Decide what you will do based on the individual's care plan and the policies in place in the facility where you work. Step 3. Each day, check for problems before starting. Look at the face, cheeks, and jaws, and ask about any mouth pain. Step 4. Coach the person to do as much as they can. Then finish removing all the plaque germs they missed. Step 5 is cleaning any removable teeth, such as dentures or partials, daily. Put a towel in the sink so fragile dentures, which get slippery when wet, won't break if accidentally dropped. These plastic teeth are coated with plaque germs, just like teeth, so they need to be brushed clean. Step 6. Now, use the toothpaste or anti-cavity mouth rinse containing fluoride. Remember, at the end of your cleaning session, you want the teeth coated with fluoride because it strengthens tooth enamel. Step 7 is to provide some praise and thanks and record your work. Follow the routines in the facility where you work to record mouth care activities. Frail elders and adults with disabilities can be uncooperative with daily brushing for many reasons. This can be frustrating for caregivers, but it can also be very rewarding to overcome. Once you understand some of the reasons for uncooperative behavior and learn how you can help change it, you'll become a skilled and successful caregiver.
See? Isn't that your favorite color? No? You want to hold it? Want to try?
Start by figuring out the nature of the problem. Is it due to lack of knowledge or good brushing techniques, physical barriers to carrying out the care plan, or lack of ability to cooperate?
Got nice soft bristles on it so it won't hurt your gums. All right, good, good. And then we'll get some toothpaste on there.
Some caregivers have found that they can help some people who have difficulty cooperating by using the following techniques to overcome obstacles to oral health. Create an environment for success by using simple communication, providing reinforcers, and using partial participation. Let's begin with creating an environment for success. Try to find a time and place that's most likely to work with the individual you are helping. Ask for advice from the people who know the person best.
Hi.
Hi.
What are you doing?
Watching TV.
Oh, yeah. Would you like to go brush your teeth before we watch Wheel of Fortune? It's on in just a few minutes, so if we brush our teeth right now, we can come back and we'll be able to watch the whole program.
For other people, creating an environment for success means combining daily mouth care into another routine personal cleaning activity. For example, couple the toothbrushing session with a nighttime ritual where the person takes a shower or washes their face. Figure out what works best for that person and add that to the individual's daily oral health care plan. Make daily mouth care part of an established routine, such as after dinner or before bedtime. Your goal is to structure a pleasant, non-threatening time, place, and routine which encourages cooperation.
Now here's your big toothbrush with a nice big handle that you like. And why don't we start on the bottom and show me how you do it.
For some people, like individuals with memory loss and dementia, you need to proceed very slowly and use very simple communication techniques. When starting the daily mouth care routine, begin by approaching the person slowly from the front. Touch the person lightly on the shoulder or wrist. Try to place yourself at eye level with the resident if possible. Establish eye contact. Remember, some people may have trouble seeing you or hearing you very well. And for people who can't understand words or what you're saying, making sure that you have friendly and encouraging facial expressions and body language goes a long way. When speaking, use simple sentences. Speak in a calm and friendly voice, using the individual's name frequently. Give only one instruction at a time. You may not be able to do complete mouth care for a very uncooperative person. For some people, you need to do a little bit at a time and then do more later.
Okay, I'm just going to slide them in. Oh, beautiful. Fantastic.
Some people will respond to reinforcements for improved behavior.
So when we decide to reward someone, what kind of things can we use?
We could use like a magazine.
Okay, let's discuss the importance of providing positive reinforcers and what they are. Reinforcement may consist of words of thanks, praise and encouragement,
Great job.
smiles, and pleasant eye contact, or appropriate touching like a high five or a gentle tap on the shoulder. Reinforcement can also be provided by giving a favorite item like a magazine or spending time together listening to music or playing a game. Remember, avoid using sugary foods like candies and soda as rewards.
And I want you to know that you did a fantastic job.
At the beginning, you might provide a reward for doing the first small part of the task. Later, you will provide the reward when more of the task is completed.
Come on, Mike, you can do it. Just brush your teeth. Good job. Look at you. Wonderful. You'll have enough time when we can look at a magazine or do something nice, maybe go out for a walk.
All of these techniques sound separate from each other, but once you get good at them, you will see how they are all used together and customized for each individual and situation. As we've seen with brushing teeth, some people may not be able to complete their daily mouth care routines without assistance. It is very important to encourage each person to do as much as they can. If they cannot clean their own mouth, you will need to help. If you do need to help, there are some positions and devices to help open the mouth and make things easier. One very helpful tool is called a mouth prop. If regulations in your home or the facility where you work permit, you can use tongue blades as a disposable mouth prop. You can also purchase a hard foam mouth prop that can be used more than once. To make it easier to see and to support the head, use the mouth prop in positioning you see here. Some people have difficulty swallowing. To be sure they don't choke, you might need to position that person so they are sitting up during mouth care. We find that the techniques we've been discussing can be used more effectively if we write them down in a plan.
So this is the daily oral health care plan. So we are able to do the best job that we can in the least amount of time. Does this make sense to you?
This daily oral health care plan makes it easy to organize and communicate what works for each individual, what we are working on now, and what are our plans for the future. We keep it in the chart so everyone can know what is going on.
So what do you think about all this?
You know, I think I'm starting to get the hang of it.
Good.
Just takes some getting used to, I think.
Yep, with some practice, things go a lot smoother.
Yeah.
In this video, you have seen a number of ideas and techniques. Remember, you will decide what you will do based on the individual you are working with, their individual care plan, and the policies in place in the facility where you work. By using the techniques we've discussed, you will gain cooperation and powerful new tools to overcoming obstacles to oral health. As disabled adults and frail elders experience improved oral health, they will feel better about themselves, interact more with others, have greater physical comfort, and a new smile with which to face the world.